Hi, everyone. Welcome back to another episode of Seek Your Summit. Today, I have Dr. Bill Cimikoski from Utah Stem Cells. He's helped me along my journey. You guys have been asking for these experts behind the scenes. I'm so excited to share his wisdom today. Dr. Bill, thanks for joining us.
Thank you, Jen. I'm so glad to be here.
All right, Dr. Bill, my magical Utah stem cell doctor. Let's bring our audience up to speed with how you got interested in stem cells to begin with.
Well, it's kind of a little bit of an interesting story because I didn't set out to become a stem cell doctor when I wanted to go into medicine. I definitely wanted to be a doctor, but I was actually very interested in becoming an orthopedist initially. Why? Because I had so many knee injuries growing up. At the age of 13, I started having knee dislocations. I had my first knee surgery at age 14. By the time I was 17, I'd had 7 knee surgeries between the two knees, and the left knee was a little worse than the right, and I had major reconstructive surgery done at age 17, which essentially ended my career in contact sports. When I say career, I played very passionately all my life. I was a very big hockey player. Soccer and lacrosse were my big sports. I came from the New York City area in Connecticut. And my doctor at that time was the team doctor for the New York Yankees, who was the orthopedist. And I thought, one day I'm going to become an orthopedist and help prolong other people's careers or help people get to the playing field that otherwise might not have been able to make it so that they can have great careers. Now, I ended up going into another field in medicine. Once I got to medical school, I really became passionate about emergency medicine. And then I realized that sports medicine was a subspecialty of emergency medicine, so I could still be a sports medicine doctor. So that's kind of where my focus was on. And I became a critical care toxicologist on top of an emergency medicine specialist. I also became a sports medicine specialist. I also became a trauma specialist. I did 7 years of postgraduate residency and fellowship training before I decided to leave all of that and become a stem cell regenerative medicine doctor. So why did I become a stem cell regenerative medicine doctor? Well, I was looking for a solution to keep my body going for myself. I never wanted to give up skiing moguls or jumping off cliffs and things like that with skis, of course, and other extreme sports. I wouldn't be able to do that with a knee replacement. And so I was just looking for a solution to keep myself going. Once I learned about stem cells and how well they work to treat my knees, I thought, why don't more patients know about these treatments and why don't more doctors know about these treatments? So then I started getting the training myself in interventional orthopedics. The old-fashioned term is called prolotherapy, but the new term is interventional orthopedics. And I got all that training done so I could bring it to patients. And then for a while there, I was doing emergency medicine and toxicology on the side while I was treating joints and helping people with stem cells. But eventually that career, that part of my business, of my profession became so busy, I didn't have time for emergency medicine anymore. So I left it completely. And now that's all I do is stem cell regenerative medicine.
Wow. And for somebody that's new to stem cells, like what are they and why are they so powerful?
So how do stem cells work? Let me break it down for you really simply. When you have any ailment in the body, whether it's an acute injury or an injuries that occur with age, arthritis is one of those. Arthritis is a wearing and tearing down of the cartilage that we all get in all the joints of the body. But the reality is that's just one form of an injury. Another type of injury would be cutting your skin or having a heart attack or spraining your ankle. These are other forms of injuries. Well, all those injuries are trying to be healed by your stem cells. You have stem cells that are laying dormant in your body, primarily in your bone marrow and your fat. And when you have an injury, your body will send a signal to the stem cells to come to the site of the injury and fix that problem, no matter what it is. So if you have a heart attack, stem cells are going to migrate through the bloodstream, arrive to the heart muscle. When it arrives at the heart muscle, those stem cells are going to turn into heart cells. They're in an undifferentiated state, something like a joker card in a deck of cards. They're just waiting to be told what they should become. That's how your body repairs everything in the body. So stem cells are just waiting to be told what they should become. And when you have a chronic injury that's not getting better, let's say that you you hurt your shoulder. We're going to talk about your shoulder soon. You injured your rotator cuff. Well, if the body sends enough stem cells into that area, it's going to repair and it's going to do fine. But if it doesn't send enough of those stem cells in, you're going to end up with a chronic problem. So then I can come in and I can inject directly where they're needed, directly into those structures: cartilage, ligament, tendon, labrum, menisci. These are all the different types of orthopedic structures that help with the function of a joint. And if you have pain in the joint, it's going to be one of those structures or multiple of those structures that's causing that pain. So an individual like myself that's trained in interventional orthopedics, I can come in and I can inject each of those areas specifically with the stem cells and put them precisely where they're needed. So where do we get those stem cells? We could get them directly from you. That's how I got my start. Over 10 years ago, that's the way everybody did it. We could take it from your bone marrow or from your fat. That's where you have a lot of it stored. But most doctors were transitioning to the fat harvesting technique because it was a little bit easier to get more of those stem cells with a little less trauma to the patient. Well, that worked fantastic. But then we learned that we could get the stem cells from the placenta first and then the umbilical cord from a donor mother's placenta and umbilical cord at the time of birth. So there was a lot of controversy in the old days when embryonic stem cell research was being conducted. We knew that embryonic stem cells work great at repairing things. And I don't know if anybody remembers Christopher Reeve, who used to play Superman. Back in the 1980s, he broke his neck. And there was a lot of stem cell research being done at that time to help spinal cord victims. That was done mainly with embryonic stem cells. And that slowed down a little bit of the progression of the science, because nobody really wanted to promote aborted fetuses as the source of where we get those embryonic stem cells. But once we learned that we could get stem cells from the umbilical cord in particular, these stem cells are actually more powerful and more potent than the embryonic stem cell. That's what most scientists believe, because if you think about it, a lot of embryos end up in miscarriage. About 80% of all embryos do never make full gestation. But when a mother makes it to a full, live, healthy birth, that's a perfect system. So that umbilical cord stem cell we can now use. We can do that here in this country. We've been able to legally do stem cells here in this country for a long time. At first, we would take it from the patient and put it right back in them after we spun it down and concentrated it. But now we get it from the umbilical cord. And these have properties that are much more potent and present than your adult age stem cells. Plus, I don't have to put you through the harvesting procedure. So we get better results. It definitely works when we use your adult age stem cells, but the umbilical cord stem cells is a much superior source. And as long as the doctor's not charging you exorbitant prices to use those umbilical cord stem cells, those are the ideal stem cells that we use today.
Okay. That's interesting. Yeah. And so what are the main applications that people are using the stem cells for? I know for me, when I went to climb Kilimanjaro, I used them to see how it affects my recovery and just absorbing that big attempt. And I had more energy. I recovered perfectly. I was ready to go every single day. And that was a different experience than I've had on other mountains. So I know it made a difference for me. But aside from that piece, like, how are people using them?
Okay, very good that you brought that up. So I do treat high-level athletes sometimes that are training for competitions as a lead up to competitions. I treat a lot of UFC and MMA guys, for example. And a lot of times those players or those athletes will get injured in the training sessions leading up to a contest. And then they want to make sure they're in the best shape for that contest. So that's one reason to do stem cells. And that's kind of one of the reasons we did it ahead of your expedition, especially since you didn't have any specific joint that was bothering you. So we're proactive, and you can do it for those reasons. We can also do stem cells just for health and wellness. So when we do stem cells for health and wellness, what am I talking about? We can just start an IV, push the stem cells into the IV, and have those circulating around the body. I recommend everybody do at least one of those per year just for the health and wellness benefits. We can't direct those stem cells where to go. We can't tell them if you have a kidney problem or if you have a heart problem, if you have diabetes. We can't tell the stem cells, hey, I want you to go help with the diabetes. Hey, I want you to go help with the kidney function. You have traumatic brain injury. It's great for that. I can't tell the stem cells go to the brain. But what we can do is put it through the IV. And if you look at the different studies that are associated for treating things like Crohn's disease, multiple sclerosis, Parkinson's, COPD, congestive heart failure, these are just a myriad of different types of illnesses that are all different and all affect different organ systems. But we do all the treatments the same way. We're just putting it through the IV. And even though we can't tell the stem cells where to go, they have a propensity to find what's hurting and what's not working right and fixing it. That's what they're programmed to do. But the bottom line is, if you look at the studies associated with treating all these different diseases, right? Autism, COPD, multiple sclerosis, all different types of conditions. We're doing them all the same way through the IV. But if you look at the studies and the results, you find that all those studies, with very, very few exceptions, show significant improvements in treating the symptoms or the ailments associated with those diseases. It doesn't typically cure the diseases, but it helps you living with them much better. A lot of times you can get off your medications that you're on to help with pain or other immunomodulators if we're talking about things that are autoimmune or maybe need, immunotherapy. You can get off those medications. And the stem cells works wonderfully to treat all those things. So that's the premise behind doing IV stem cells, even when you don't have a particular disease you're trying to treat, is you have those circulating around, nipping them in the bud before they become a problem. And before we go on to too many other tangents or topics, I will just mention one other thing that goes along those same lines. We now have a blood test that's brand new. A lot of people don't know about it, but it is a blood test that will screen for over 50 types of cancers, and most of them are the aggressive type of cancers like pancreatic cancer, colon cancer, lung cancer, breast cancer. We have a blood test that will screen for all those different cancers, and with a 95% accuracy rate, it'll tell you whether you have an existing cancer right now. So the reason we do those is that if we can catch a cancer early in stage 1 or 2 before you feel the symptoms, even the most aggressive cancers, about 90% of them can be eradicated if you catch them in stage 1 or 2. The problem is we're not catching them till stage 3 or 4. So that's a new blood test that we now have in the clinic that's available for people to take that will screen for cancers. So I'm often talking about those screening tests for cancer while I'm talking about stem cells, because stem cells can nip a lot of things in the bud, diseases and other problems before you even feel the ailments, before the symptoms.
And so I have an injured shoulder right now, and I came to you to try to do stem cells because I wanted to do that before surgery or other things. When somebody has an injury, how many times are they doing stem cells before you're like, oh, okay, I don't know, maybe we do need to do surgery in your case?
First of all, stem cells don't have to be super expensive. I don't charge a lot of money. I've been doing this for a long time, and I keep costs reasonable and affordable. A lot of stem cell doctors out there will try to make all their money off of 1 or 2 patients. At the end of this discussion, we should put a link on it. And what it is I'm doing a TED Talk right now. I'll be giving this in front of a lot of people in Munich in just about 2 weeks, and we'll put links to it. But the TED Talk is this: what are the 5 most important things you should look for in a stem cell doctor? Because there's other doctors besides myself that can do these treatments. I don't want to pretend like I'm the best or the only one that knows how to do this. I've been doing it for a long time, about 15 years, so I'm pretty darn good. But I've trained with people that have been doing it longer than me, that are better than me. But the problem is most people don't know where to look or how to find those things. We're going to talk about those different things. But I wanted to answer your question really quick. How many treatments are required? So let me just give you the quick answer for that. So we're using better quality products now. Now we're getting the stem cells from the umbilical cord. When we used to get it from the patient and would take it from your bone marrow or fat, I would tell people, you might need 2 or 3 treatments. You might need it might take a couple more. When we were doing it with just platelet-rich plasma, which was a possibility before we learned we could add stem cells to the mix, then I would tell people you need 3 to 5 treatments to get a good result. Well, here's how it works in today's world with the stem cells that we use that come from the umbilical cord. So When people have pain levels of 8 out of 10 or higher, which is just a number that a lot of people give me, 8 out of 10, 9 out of 10, 10 out of 10, when they're talking about back pain, shoulder pain, knee pain, you name it. So 60 to 70% of the time, I can get the pain level to a 0 to 2 out of 10 pain. So completely gone or just barely noticeable. 30 to 40% of the time, I can't get it to 0 pain, but I can cut it in half. I get it to a 3 or 4 out of 10, and most people are really happy if I can get a moderate or complete improvement. So if I can cut it in half, most people are happy with that. And that makes up 90% of the people. There's a 10% chance it only goes from an 8 out of 10 to a 7 or an 8 to a 6. I consider that a failure. It's very rare. We tell people nothing in medicine works 100% of the time, and there will be some failures with stem cells. So now, how many treatments are required to get you to those great results? 60% of the time, so a little more than half the time, we do one treatment and you're finished. I get you to 0 pain. 40% of the time, you might need 1 or 2 follow-up treatments. I can never predict who those people are. Sometimes you think it's the 90-year-old with 20-year-old knee pain, horrible arthritis, bone on bone. You think they might need 2 treatments to get a good result or 3. No, they only need 1. And then I've got the young 30-year-old guy who's got mild arthritis, just a little bit of meniscus damage. And you're like, oh, this should be easy. You're only going to need 1 treatment. No, they might need 2. So you can never predict who those are. It's not based on how severe your disease is. So anybody that says you're too far gone doesn't work that way. We can talk more about that when we have time. Usually 60% of the time, 1 treatment, and 40% of the time, 1 or 2 follow-up treatments. I'll even tell you what the cost is for a follow-up treatment right now. Why? Because I do something that I don't know of any other doctor that does this. And that is, after I treat the joint one time, I make all my money on the first treatment. And I can, what is the cost? I'll tell you right now so you guys know. Depending on how many joints you treat, the cost is between $4,000 to $5,000. So if the more joints you're treating, it makes more sense to do it at the same time. You're going to pay less money. But it's around $4,000 to $5,000 for most joints like knee, shoulder, ankle, back, neck. It's around that cost. So if you fall into the category that needs one of the follow-up treatments, I only charge $2,000 for all follow-up treatment. People want to know, how long do these treatments last? Well, it's meant to be indefinitely. When you get a good result, it should last forever. The bottom line is that's how many treatments are required. It's usually 1 followed by the possibility of 1 or 2. And what is the prognosis? Greater than 90%, you're going to get moderate or complete improvement. Stem cells should always be the first line treatment before any surgeries. Some things do require surgery, but it's very, very rare. But it should always be a first-time solution. So when you do surgeries, the complication risk is very high. Depending on the different parts of the body we're treating, if we're treating neck and back, for example, those are only 25 to 50% successful because they're not really getting to the root of the problem. We can talk more about that later. But the complication rate is very high for a lot of these things. And if you do these procedures and end up with a bad complication, you're stuck with that for life. So it really should be a first-line treatment before all surgeries whenever possible. There's a lot of reasons why stem cells isn't covered, and none of it is based on the fact that some people like to say, well, it's still experimental, it's not proven. Not true. There's been more studies completed on stem cells than anything in maybe the history of the world in medicine. And in the last 20 years, there's been thousands and thousands of completed studies that show the safety and the efficacy of these treatments. So the only reason they're not being done more commonplace is the corruption. I'm going to change that. I'm going to get the word out. You and I are starting right now, spreading the word so more people know about this stuff.
Yeah, definitely. So if you have an injury, does it make more sense to inject that injury or just do the IV? Because in the IV, like, your body knows where to send it.
Here's the thing. When you have a specific injury, like to a shoulder, knee, ankle, back, it's always better for me to treat it directly because I'm trained in the prolotherapy technique, which has been around since the 1950s and 60s. A lot of people haven't heard of it. I knew nothing about it. So prolotherapy is the practice of injecting directly into those structures where it's needed. So when I examine a shoulder, knee, back, I'm looking at treating all the structures that are responsible for the function of that joint, but I do customize it to each individual because sometimes when people have shoulder problems, more of the problem is the labrum and arthritis. But 9 times out of 10, it's the rotator cuff tendons like it was for you. So I'm going to put more of those stem cells into the rotator cuff tendons and left into the arthritis if that's your case. But for some people, it's the opposite. I have some people that all their problem is labrum and arthritis, and the rotator cuff is fantastic. So I'm going to put most of those stem cells into the arthritis and labrum and not the rotator cuff. So we can do it like that to recover things. But I'm going to use the example of rheumatoid arthritis because some people know what that is. Rheumatoid arthritis, unlike osteoarthritis is the arthritis that we all have that usually affects a couple of the joints, maybe 1 or 2 joints. Rheumatoid arthritis is an autoimmune condition that affects multiple joints more commonly. So when people have rheumatoid arthritis, often they have pain in multiple areas, their hands, their feet, their shoulder, their knees, their elbows, right? And I could go treat each of those areas directly, but it's impractical and it's expensive. So we do IV stem cells in that case just to treat everything, right? So for those rheumatoid arthritis patients, here's what I tell them. If you got a really bad shoulder or a really bad knee, we treat that directly. But we can also do IV stem cells to treat everything in the body. And we can do those together. It's not uncommon for me to do both. Anybody who, I hope everyone's going to follow me on my Instagram. I treated a very high-level, best extreme athlete skier in the world, one of the best in the world, but the number 1 ranked U.S. extreme skier currently is Kendall Goodman. And he was filming for an extreme skiing movie in Japan, and he had an avalanche barrier. He broke his pelvis. He tore up his hamstring. He tore up a bunch of different muscles, and he broke his pelvis. So what did he do? He came in. I treated those areas directly, his hamstring, his pelvis, but I also did IV stem cells because he was jacked up all over. So that would be an example of treating some things directly and doing the IV stem cells. When we treat the rheumatoid arthritis patients, sometimes they come in every couple years or whenever their RA starts getting bad again, and we do an IV stem cell treatment. But if they have a really bad shoulder, really bad knee, it's always better to put those stem cells directly where they need to go, because not only will I put those stem cells directly into those structures and they will stay there, but your body will send a signal to your own body's platelets and stem cells to join that fight, to assist by adding more cells to that area.
Okay. Do you find, like, if somebody is going to go into competition or they're going to go into surgery, is it better to do stem cells before or is it better to do stem cells after?
Sometimes you do it either way. So most of the time, when people have an injury, like I'll use a knee injury as an example. I had a physician fly out from Austin, Texas who was convinced he needed a meniscus surgery. All right. Because most of the time I can heal all meniscus, including his, but he had a flap that was getting stuck, and he was convinced, I'm going to do the meniscus surgery, but I want to use your stem cells to heal everything else, because he needed arthritis healed. He wanted his meniscus surgery to heal more quickly, and he wanted the tendons and ligaments, everything treated. So he came out for a treatment before he had his surgery, and he came out for one afterwards. But you can do it that way too. But most people are going to choose one or the other. So I'm just saying there are exceptions to the rule I'm saying. Another exception to the rule is for hair regeneration. Stem cells works great at regenerating the hair follicle, but sometimes people have such thinning hair. Like if you're completely bald on top, like my forehead, that hair follicle is too far gone. That's stage 4. Is shrivel up like a raisin. We can't restore it. But if you're still making some hair, we can. So some patients are good candidates for a hair transplant. They really do need that. Plugs, not just the stem cells, but they still have a lot of good hair. They want all the good hair to make better hair, but they can still do the plug. So what do? A lot of times they come in before they go for a hair transplant to have those stem cells placed to make everything healthy before a hair transplant. Then they'll do the hair transplant. Then they'll come back to me for more stem cells to help those stem cells take effect, and then to help all the other hairs also do well. Finally, to end that subject, a lot of times people have an indication for surgery, because sometimes if you tear a tendon completely, I'll use the knee as an example. A lot of people will tear their ACLs, anterior cruciate ligaments. When that ligament is torn, the ends can sometimes retract and get too far apart, and then the stem cells won't get it together. When you have a full thickness ACL tear and the ends aren't too far apart, we can still get it together with stem cells. The amount of distance that we can still get it together with stem cells is about 2.5 centimeters. Okay, that's just the tolerance there. So when people have an ACL tear that's bigger than that, I'll send them to surgery and say, listen, you're better off getting surgery. Stem cells won't get that together. But then they can also get stem cells after the surgery to help that ACL repair better. But they've also hurt their cartilage and other things, and the rest of the structures I can still treat. So usually if someone's going to get a treatment after surgery, what is the timing that I tell them to come back? Usually 1 month. Why do I wait 1 month? Surgeries are much more prone to infections than my procedures are. I don't want to get blamed for an infection after a surgery. So I usually tell people wait 1 month, because usually most infections are going to happen in the first 2 or 3 weeks. Sometimes infections happen later than that, but usually in the first 2 or 3 weeks is when infections occur. So I want to get through that before I put a needle in there, because I don't want to get blamed for any problems if a person gets an infection. So that's kind of a general rule of thumb: wait 1 month before surgery. But better yet, most of those things can avoid having surgery altogether, and we can treat things like shoulders. There's so few times where I can't treat a shoulder. Shoulders do amazingly well.
Yeah, you said backs maybe do the best, right? Like what body parts do the best? The back and then the shoulders?
I treat a lot of knees, shoulders, ankles, but the two best treatments on the planet are backs and shoulders. And there's a reason for that, because here I'm going to blow the mind of all your listeners that have back pain. I'm going to tell you all the things that don't cause back pain before I tell you what does. And what I'm about to tell you shows up on everybody's MRIs. If you get an MRI after age of 30, here are all the things that are going to show up on your MRIs, and none of these cause back pain. Bulging discs, let's just throw that out there. Bulging discs are like Rodney Dangerfield. Can't get no respect. The bulging disc gets blamed for everything. Everybody's got bulging discs. It's a fact of aging. They don't cause back pain. Arthritis does not cause back pain in the back. It causes back pain in the fingers, often causes back pain in the knees, very rarely causes it in the shoulders, and never causes it in the back. All right. Alignment issues where the vertebrae don't line up right on top of each other. Some people have a curvature like scoliosis. Sometimes the curvature, the bend isn't right. The alignment isn't right. Alignment doesn't cause pain either. Spinal stenosis, we all get that as we age. That's the narrowing of the spinal canal. That does not cause back pain either. When it's really severe, it can cause motor deficits and other neural deficits, but not pain. So a degenerative disc disease, we all get degenerative disc disease as we age. That's just a wearing and tearing down of that disc. It gets compressed. We all get that. So now everybody's thinking I named everything that causes back pain, right? And everyone's going, yeah, those are all the things on my MRIs. How come my discectomy didn't work? Because that's not the cause of your back pain. How come your back fusion didn't work? That's what takes care of arthritis, because it didn't work, because that's not what causes back pain. So what causes back pain? The tendons, very similar to the shoulders. The rotator cuff tendons is the most likely culprit in the shoulder, but there are exceptions to that rule. In the back, there's virtually no exceptions to the rule. So 99 out of 100 times when people have back pain, it's coming from the tendons. When they get torn, worn, or diseased, they will irritate the nearby nerves. And if they irritate the sciatic nerve, for example, a lot of people get sciatica pain, which is pain that goes down their leg. It's not because that nerve is getting compressed by a bulging disc. It's not that nerve is getting compressed by arthritic changes. What's happening is that sciatic nerve courses through the SI joints, the sacroiliac joints. So even if you had no pain in your SI joints, which 99% of people do, that's where a lot of my fluid goes. When I treat a pelvis and low back, which is together, it's about 60 to 70 injection points I need to hit.
Wow.
When I treat a shoulder, a knee, a hip, it's about 15 to 20.
Yeah.
And the neck, it's about 30 to 40 injection points. It's all one treatment. It's all the same cost, but it's just I just have to hit a lot more spots. When I'm doing a low back, it's 60 to 70 injection points. And why am I doing it? Well, I am treating I have to treat each of those vertebrae individually. And I got to hit about 5 to 7 spots on each vertebrae. I've also got to treat the pelvis and the SI joints for the reasons I told you. It just so happens when I ask people, no matter how old you are, no matter how much pain you're having, when I ask a patient, where do you get your back pain? It doesn't matter where their bulging discs are located. They all point to the same area, in the SI joints and across the iliac crest. Again, that's where the key stabilizing tendons and ligaments are located. So getting back to your original question, why do backs and shoulders do better than any other joint in the body? Because some things in the body heal up more thoroughly, more easily than other structures. So I told you I can treat cartilage, labrum, menisci, tendons, ligaments. Tendons and ligaments are the easiest and the ones they heal up the most fullest. So because it's a tendon problem in the shoulder most of the time, and because it's a tendon problem in the back all the time, with very few exceptions, that's why those do so well.
Wow. Yeah, that was really informative. It's nice to know. If you guys have back pain, I would check out Utah Stem Cells before going in too much further on anything else. Okay, so a couple more questions and then we're about up for today. Where do you see stem cell research and treatment heading in the next 5 to 10 years?
First of all, we already know beyond a shadow of a doubt how well it works in the orthopedic world. But what's going to change is this. People want to know, well, how many treatments do you need to do if you're doing an IV stem cell treatment to treat my diabetes or my congestive heart failure or my autism, whatever it is, right? So collectively, most scientists agreed that 1 or 2 million stem cells per treatment is a meaningful amount. And then 2 or 3 treatments is a meaningful amount of treatments. We usually separate them by 6 to 8 weeks. Why? Because the life cycle of the stem cell is 8 to 10 weeks. By 10 weeks, stem cells are done differentiating into new healthy tissue. So we just do a little bit of overlap there. So basically, most studies were set up this way. At least 2 treatments, 1 to 2 million stem cells before they start measuring outcomes. Because the thought process is, well, maybe if we just done a little bit more treatment, one more treatment, or a little bit more stem cells, we would have had a great result, but we'll never know. So we always start off with that. But then once we learn that it works really great for autism or congestive heart failure, macular degeneration, any of these things, then we need to do more studies to determine what is the best amount of treatments to do and how many stem cells we should do each treatment. Because we might find that for multiple sclerosis, the ideal amount of treatments is 4 treatments, 3 million stem cells a treatment. We might find out that for autism, you do 6 treatments and you get profound results. But after 3, you're only going to get minimum results. So that's where all the science, more research, I believe, is going to take place. We already know stem cells work beyond a shadow of a doubt to heal just about anything in the body, especially in the orthopedic world. So we don't need any more studies there. But what we need are more studies to determine what are the ideal amount of treatments to do for any X, Y, or Z disease.
Yeah, no, that's great. This has been super informative on so many levels. I really appreciate your time and your expertise that you've been able to share with us today. If somebody's listening and they want to learn more and they want to explore their options, how do they reach out to you and what's the next step?
So, number one, I'm easy to find because I'm a stem cell doctor. I'm the largest user of stem cells in Utah and one of the largest in the country and hopefully in the world soon. So I'm easy to find, Utah Stem Cells. So you can find me at utahstemcells.com. I do have currently my Utah Stem Cells Instagram was in a little bit of trouble. We're fixing it, but I have Bill Cimikoski, MD. Bill Cimikoski, MD is active and we're populating a lot of things there. But look for me on social media. Go to my website. We're going to put a link I'm going to put links out there for the 5 most important things to look for in a stem cell doctor. I kind of touched about that earlier. I like to think that I'm good at what I do. I'm very proud of that, but I'm not the best. And there are a lot of other doctors out there that are fantastic, but for all the good stem cell doctors that are out there, there's 20 out there that aren't doing things, aren't trained in the right way, aren't using the best quality stem cells. So I'm going to just tell you, and I won't give you the full talk because that's a 15-minute talk, but you need to make sure that you're going to a doctor that's, if you're going to do interventional orthopedics with them, he better be trained in prolotherapy and better yet, board certified in interventional orthopedics. I'm board certified in interventional orthopedics. So you want a doctor who's well trained in the prolotherapy technique or interventional orthopedics. You want a doctor that's using the very highest quality stem cells that are available, which are mesenchymal stem cells. And that doctor needs to send that solution, those biologics, to a lab to be tested. 4 out of 5 times when a stem cell company approaches me to use their stem cells because they can get me a better quantity at a cheaper price, it's crap. I have less than 1% viability after I thaw it out and get it tested. So you always got to make sure that the doctor is using a source of stem cells that he trusts. He puts his name behind it and he actually tested. Those are some of the highlights. Gosh, I'm drawing a blank of all of them. But look for the 5 most important things to look for in a stem cell doctor. Those were the highlights that I just gave you. There are other doctors that meet that criteria. I'm not the only one. They're just hard to find. I do have a lot of people that come see me from all over because we keep our costs actually a lot lower than my competitors. So in this country, most places will charge between $9,000 and $15,000 for a single IV stem cell treatment. Like I said, I use a 2 ml solution. That's 2 million stem cells, the very best I could find in this country. And I charge, my cost out of pocket to do that treatment is $4,000 to purchase the stem cells, and the consult time and the overhead for the room is about $4,000. So that's all I charge my patients. In this country that I mentioned, they charge around $9,000 to $15,000 per treatment. They're gouging people and taking advantage. If you go out of the country, and I've got plenty of people that started getting IV stem cell treatments in Panama and Colombia. In Colombia, I think they charge $15,000 for a single IV stem cell treatment. In Panama, they charge $25,000 for the same treatment you're getting with me. But I for sure vetted my stem cells. You know what you're getting. So what do I think a fair price to pay for stem cells in this country if you're getting actually good quality stem cells? I think about $6,000 is a fair price. That's what I'm going to charge eventually, about $5,500 to $6,000. There's a little bit of profitability there, but I want to treat a lot more people and make it more accessible. A lot of people just try to make a lot of money off of 1 or 2 patients, and that's not the way to do this. And that's probably stifling a lot of the advancement of the science. We can keep the cost low, treat a lot of people. Doesn't take me a lot of technical expertise to start an IV. I could teach someone how to do that in a weekend. So why? It's disingenuous for me to start an IV and charge you all this money to push it in the IV when it only takes 5 minutes to do, right? So I cannot be charging these exorbitant prices. Now you guys are armed with the information of how much you should be paying. And like I said, I just keep costs low and just cover costs. So eventually I will charge a fair price right now. But when I do, I'll grandfather in anybody that started me.
Okay, that's your notice, everybody. It's time to sign up. Go visit Dr. Bill, Utah Stem Cells, and get in his practice so that when prices go up, you're on grandfathered into the system. Again, Bill, thank you so much. We'll put everything in the show notes, and we'll see you at the office in a few weeks.
You're a star, Jen. It's such a privilege to be here with you. Thank you for spreading such amazing information, not about stem cells, but all you do for biohacking and fitness and nutrition. You're helping to change the world too.
Thank you.